I'm Katherine Walsh. I'm Senior Lecturer in Palliative Care and I'm also Co-Director of the International Observatory on End-of-Life Care here at Lancaster University. I'm involved in a number of different research projects, but my main research interests are in the provision of palliative care at home. So I've done some work looking at community palliative care services and the work of district nurses. But I'm also doing work into symptoms, particularly psychological symptoms in palliative care and how we can ameliorate those. I also supervise our students on the PhD programme in palliative care here.
Hello, my name is Katherine Froggatt and I'm a Senior Lecturer here in the International Observatory on End-of-Life Care. I do both research and teaching, and part of my teaching role is to supervise PhD students, particularly those undertaking the PhD in palliative care that we run here. My research interests are twofold. Firstly, how do we help people die and live well in care homes? And secondly, how do we raise public awareness about those issues? And I'm involved in a number of projects taking that work forward.
Hello, I'm Nancy Preston. I'm a lecturer on the PhD in palliative care. I work on two EEC funded projects. One is looking at advanced care planning and the other on how to integrate palliative care. I also have a strong interest in symptom control with a particular interest in the management of ascites. I have a number of PhD students, some of whom looking at the role of hastened death or euthanasia.
My name is Dr. Sean Hughes and I'm a researcher on a project called In Subsea, which is an EU-funded project looking at integrated palliative care for people with advanced cancer and chronic disease. The project has 10 European partners and one from the United States, and we hope by the end of the project to be able to make some best practice guidelines and guidance on integrated palliative care pathways to make sure that people with those advanced conditions get the best care.
My name is Mary Turner. I'm a research fellow in the observatory. I'm working on a stroke project at the moment. We're looking at how clinicians initiate end-of-life care for stroke patients. I'm also principal investigator on a project looking at end-of-life care for prisoners. I also supervise PhD students on the PhD in palliative care.
I'm Dr. Sarah Brearley and I'm Director of Studies of the PhD in Palliative Care. It's an innovative programme that has been developed for professionals working in palliative care. It consists of 2 years of taught modules delivered via blended learning, mainly at a distance with an annual Lancaster-based academy, and that's followed by a research phase where students undertake an original project in their home location.
Doing a PhD at the observatory has been an amazing experience for me. You know, for a PhD student, the most important thing is to get a good supervision, and the quality of support which we get here is really exceptional. My supervisors are always there for me, they are always happy to help. They read my stuff, respond quickly to my emails, so all these things which a PhD student really needs.
I'm Ivy Papavasiliou. I joined the International Observatory on End-of-Life Care in 2011 as a research associate for EuroImpact, a European-funded project aiming to improve quality of palliative care in Europe. At the same time, I'm working toward my PhD. Doing research as part of the observatory team has been quite challenging and rewarding.
My name is Janet Rigby. I'm a part-time PhD student at Lancaster University. I'm doing research into the design of hospice buildings, and I'm going to be asking patients, family members and staff for their views on how hospice buildings should be designed. And I also work part-time as a research nurse in the Division of Health Research at Lancaster University, and I'm aiming to improve recruitment to various research studies that are being undertaken by colleagues.
Hello, my name is Juliano. I'm a PhD student from Brazil, and I was accepted here in the observatory 8 months ago as a visitor researcher. My experience here was remarkable. I had the opportunity to work with high-level researchers who helped me conducting part of my project for my PhD and who was able to participate in some of their projects as well. This period here in the observatory was life-changing for me, and I will be forever grateful for them. I would recommend it to everyone who wishes to improve their research skill in palliative care.